that is Yale-Brown Obsessive Compulsive Scale. Very important, very commonly used, widely used, and we'll talk about this when we discuss the severity. So what is Vibox? It is a clinician rated instrument that assesses similar items and is commonly used as a primary outcome measure in clinical trials. So often you will see clinical trials related with OCD, Vibox being used. Now, adaptation of the scale include a version that provides a score for each of the major OCD symptom dimensions. So again, there are various versions. We'll talk about one which is used in the severity. Let's talk about first here, that is Yale-Brown Obsessive Compulsive Scale symptom checklist. Again, whenever you are seeing any case with OCD, especially in your initial part of residency, I always recommend have a look at this Vibox symptom checklist. Now, this Yale-Brown Obsessive Compulsive Scale, that is Vibox, is given by Goodman et al. In 1989. Now, this checklist, it has 60 specific obsession and compulsion which are catered in 15 categories. Now, this elicits both the current symptom within a month and also of the past symptoms. So, let's discuss some of the categories of these Vibox checklists. So, in obsession, so total of 15 categories we have. Obsession, it has 8 categories and 7 categories for compulsion. So look, some of the important categories in obsession. You'll find aggressive, contamination, sexual, religious, somatic, symmetry, hoarding, and certain miscellaneous things you will get in the categories. Then next is for compulsion. Again, there are 7 categories. One is checking, ordering and arranging, counting, repeating the rituals, then cleaning, hoarding and collection, and 7th is miscellaneous. So whenever you are seeing any patient, especially when we are in the initial phase of our learning, always try to have this checklist so that we don't miss any of the obsessions or compulsion. Usually it caters one of the checklist which caters nearly all of these obsessions and compulsions.